Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. And today's topic is endometriosis. What is endometriosis?
Well, Neil, endometriosis is when the lining of the uterus grows onto places where it shouldn't be. For example, the tubes, the uterus, the ovaries can grow onto intestines, or any place at all inside the peritoneal cavity, which we commonly refer to as stomach or belly, and also it can grow in scars.
What are the symptoms of endometriosis?
Well, the most common symptom would be monthly pain, although after you've had it for a while, probably the pain is all month long, just worse at the time of your period. And it's really when it's what happens with endometriosis is that you have bleeding, and the bleeding can't go anywhere, and that's what causes the pain, and it also causes the spread of the endometriosis.
Does endometriosis interfere with pregnancy?
Yes, it does, and it has for a long time. Certainly it causes sometimes the trouble with the release of the eggs or the sperm, can also cause inflammation, can interfere with hormone metabolism. It can block fallopian tubes. It can stop transfer of the fertilized egg through the fallopian tube, and it can also make difficult implantation of the fertilized egg in the uterus.
What are the pregnancy risks for endometriosis?
Well, if you look at the subject long term, most people would say there are no risks. In other words, once pregnancy occurs, there's really very little downside to having endometriosis.
What are the treatments for endometriosis?
Well, the most common would be pregnancy, and that's kind of ironic because endometriosis prevents pregnancy, but most women who have endometriosis wind up getting pregnant one way or another, probably in vitro and maybe some surgery. But Lupron is a medication that puts hormones in neutral. It does that for men and for women. So that's one thing. And another thing is menopause. The hormones decrease, or in some cases get shut off completely. So removing hormones from the endometriosis or from the environment really treats endometriosis.
And the best place to go is ruraldocallen.com and purchase Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Allen podcast, guys. Take care.